This is the scan of the room. Okay, so I'm going to start first by washing my hands. Then I'll be donning my gloves. And I'll be wiping my stethoscope. And I'll introduce myself. Good morning. My name is Sarah. I'm a student nurse from Seneca College, and I'm here in the hospital for my clinicals. And I'm here this morning to do a general assessment for you from your head to your toe. But before we start, please can you state your name for me and your date of birth, and I'll confirm with your ID. Thank you so much. Same with her ID. Then before we continue, do you want to use the washroom? You're okay. All right. Are you comfortable seated? Patient is comfortable seated. So we're going to start with the general survey. And for the general survey, I'm going to start with the physical appearance. The patient is the patient skin is appropriate to the generic background of the patient, and there's no any odor of the from the patient at the moment. Then for the body structure, the patient is seated at the upright position, and there are no any deformities that I can see at the moment. The posture is good. The nutritional body is the fat is evenly distributed in the body of the patient, and the posture of the patient is equally fit. Then I'll be moving down to the behavior. For the behavior, the patient is well dressed for the weather. The personal hygiene is clean. The patient is maintaining a good eye contact with me, and the mood of the patient, the speech of the patient is clear and audible, and the mood of the patient is friendly. Then we'll be moving down to the mobility. For the mobility, please could you just walk to the door and back. So when the patient moves to the door and back, the gait is smooth and well balanced, and the range of motion is even, is accurate, and is smooth. Thank you so much. So now we'll be moving to the walk of breathing. And for the walk of breathing, it is smooth and is well balanced. Then for the level of consciousness, do you know can you state your name again? Do you know where you are? What time it is? So patient has stated these 3 questions that I've asked. So the patient is alert and is awake. Then we'll now move to the inspection and the palpation of the head and the skull. So I'll start. So for the head and the skull, do you feel any pain? So there's no any lumps. There is no any deformities. I don't feel any deformities. Do you feel any pain? There's no pain. So the head is the shape of the head is even proportional to the body, and the hygiene of the head is clean. So the skull is and the scalp is good. Then for the inspection and the palpation of the hair, I'm going to be inspecting it. There's no any infestation or foreign bodies in the hair, and that is it. Then I'll be moving to inspecting and palpating the facial structure of the patient. So for the facial structure, do you feel any pain? There's no pain, no tenderness. Okay, and the body temperature is warm. Then there's no any scar around. I can see there's no swollen, and the face is symmetrical. The shape of the face is rounded, and is appropriate. Then I'll be testing for the CN criminal nerve 7, so which is the facial. So please, I'm going to be asking you to demonstrate some things. Can you smile for me? Can you frown? Show me your teeth. Pop off your cheeks. Okay, shut your eyes. Thank you. So when patient did all these signs that I asked her to do, all the signs with the both parts of the face are both symmetrical and they are intact. So I'm going to be moving to the eyes. So for the eyes, I'm going to be inspecting the eyelashes, the eyelid, and the eyebrows. So for the eyebrows, the hair is evenly distributed. I don't see any discharge, and there's no any crusting around the eyes. There's no lid lag on the eyes. Thank you so much. Then I'll now be testing for criminal nerves 3, which is the olokomotor. So for that, I'm going to be using my meter ruler to measure your pupil size. This is 4 mm, and to this side is 4 mm. For the symmetrical, the both sides are equal, and then for the shape of the eyes, they are round. Then for the direct and the consensual light reflex, so I'll be checking from here. Thank you. Just keep your eyes straight. Thank you. You're doing so well. So for the direct and the consensual light reflex, they are both, the eyes both constricted. Then I'm now going to be checking for the accommodation. So please, can you just look at my pen from here? Then I'm going to be bringing it close to your eyes. So at the time of this test, the eyes were both dilated, and the accommodation converged when the object was brought closer to the eyes. Thank you so much. So now we're going to be moving to the ears, and then for the ears, I'm going to be inspecting your ears. So the ears, there's no any discharge, there's no lesion, the ears are both symmetrical. Then I'm going to be palpating for the atrigos and the trigons. The atricles and the trigons of the ears. So for the atricles, do you feel pain? For any tenderness? How about the trigons? So there's no pain, there's no tenderness, they're intact. Then I'm going to be doing the 3 whisper tests for you. Please repeat it on each side of what I said. So patient has repeated the words I said to her. The first ones were Monday, Tuesday, Wednesday, and the second one was red, yellow, green, which were the words I said. So now we're going to be moving to the nose, and for the nose, I'm going to inspect the nose first, and the nose is in the midline position. I don't see any discharge around the nose. Then I'm going to be palpating the frontal and the maxillary synapses of the nose. So for the frontal, let me know if you feel any pain. Is there any pain? No. Then the maxillary, do you feel pain? So there's no pain and no tenderness. Then I'll now be moving to the lips, to the mouth. And for the mouth, I'm going to start with the lips. I'm inspecting the lips right now. There's no swelling around, there's no lesion. The lips are symmetrical. And can you just open your mouth for me? So when the patient opened her mouth, her gums, there are no swelling in the gum, there's no lesion, and there's no dehydration. And for the teeth, I don't see any loose tooth around, and they're well positioned. Let me see your tongue. Can you raise your tongue to the basement? So for the tongue, the basement of the tongue, there's no swollen, the tongue is symmetrical, and there's no lesion, and the tongue is, there's no dehydration. Then I'm going to be checking the hard and the soft palate. So for the hard and the soft palate, there's no lesion, and then it's intact. So I'm now going to be testing for the criminal nerve 9, which is the glycosopharal, and the criminal nerve 10, which is the vagus. Please, I'm going to ask you to open your mouth and say ha. So when the patient says ha, the uvula and the soft palate went up, rose up, indicating that CN9 and CN10 are both intact. Then I'm going to be testing for the criminal nerves 12, which is the hypoglossal, and for the hypoglossal, I'm going to ask you again to please open your mouth. The tongue is in the midline position. Can you move it to this side? How about this side? So can you say light, tight, dynamite? When the patient says light, tight, dynamite, there were no tremors, and CN12 is intact. Then we are going to be moving to the neck, and for the neck, I'm going to be inspecting and palpating the neck. So for the neck is symmetrical. Do you feel any pain or tenderness? No. And the temperature of the neck is warm. Then there's no lesion, there's no scar, there's no any swelling around the neck at this moment. So the neck, the shape of the neck is even, and is aligning with the body. Then I'm going to be palpating the carotid arteries, and the carotid arteries is around here. So I'm going to be palpating it for a minute. So for 1 minute, the reading is regular, and the strength is +2, and the rate is 14 beats per minute. And I'm going to be doing the same too at this side, which is the same thing too for a minute. and the rhythm and the rate and the strength is same. So now I'm going to be testing for cranial nerve 11, which is the spinal accessory. So for the spinal accessory, I'm going to put my hand here. Can you just try to turn your neck to the left side to apply the resistance? How about the right side? Then I'm going to put my hand on your shoulder and you just try to resist it. So did you feel any pain? So the cranial nerve 11 is equally intact. Then I'm going to be going to check for the upper extremities. So for the upper extremities, I'm going to inspect and palpate the upper extremity. I'm going to inspect it first. Then the upper extremities, can you roll the sleeve of your shirt? It's symmetrical. I don't see any scar on this side. There's no lesion. And there's no swollen. Same here too. Then I'm going to be palpating it now. Do you feel any pain? The temperature is warm. There are no masses. There are no deformities. And the color is the same with the genetic background of the patient. So I'm going to be checking your nails. Please, can I see your nails? So for the nails, the color of the nails are pink, and the capillary refill is nice and even. Thank you so much. Then we are going to be moving to test active range of motion. And for the active range of motion, I'm going to be asking you to please stand up. So when the patient stand up, I'll ask you to flex your fingers forward, extend it, flex your wrist, extend your wrist, radial deviation of your wrist, longitudinal deviation of your wrist. Thank you so much. Then can you flex your elbow, extend your elbow, supination position of your elbow, pronation position. Thank you so much. Can you shrink your shoulders? Can you adapt your shoulders? Adopt it. Can you internal rotation of your shoulders, external rotation? Thank you so much. So did you feel any pain? No pain? Okay, so the range of motion is intact. Then I'm now going to be checking for the radial pulse of the patient. And for the radial pulse, I'm going to be checking for 1 minute. And after a minute, the rhythm is regular. The strength is +2. Then for the test of strength of the hand, I'm going to hold your hand a little bit and ask you to try to pull it back. Did you feel any pain? So for the hand strength test, the hand is strong. Then we're now going to be moving to the lower extremities. So for the lower extremities, please can you just roll off your pants up a little bit. I'm going to be inspecting your legs first. I don't see any scar. There's no lesion. They are both symmetrical. There are no any physical deformities at the moment. And the hair distribution on your legs are even. Then I'll be palpating it. So for the palpation, do you feel pain? No pain. The temperature is equally warm. There are no masses. There are no deformities. There are no lesions. Thank you so much. So now I'm going to be asking the patient to lie on. No, before we do that, I'm going to do the pulse, the test for the pulse of the dorsal pedis. So for the dorsal pedis, is on top of the feet. So I'm going to be testing the patient for 1 minute. So for the rate, the rhythm, and the strength. So for the rhythm is regular, and the rate is 14 beats per minute. And for the strength the strength is regular. Thank you. Then for the posterior pedis, for the posterior pulse, excuse me, for the posterior pulse is behind the ankle of the leg. I'm going to do the same for 1 minute too. So the rate is the rhythm is regular and the strength is +2. Thank you so much. Then I'm going to be testing for I'm going to be testing for the planation and the dorsal flexion of the foot. So dorsal flexation is when the patient is lying down straight, and then you ask the patient to try to pull the leg backwards, and you put a resistance on it. And then for the plantation flexation is when he's still lying down, and you tell the patient to extend his leg forward a little bit, then you put your hand and apply pressure. So the dorsal flexation is like this. Do you feel any pain? And the plantar flexation is extending it forward. Did you feel any pain? So there's no pain. So now I'm going to wash my hands again. Patient did not feel any pain. Thank you so much. Then we're going to be palpating the thorax. And for the thorax, I'm going to ask the patient to turn their back and pull up her shirt upwards. Thank you. So for the posterior thorax, I'm going to inspect your posterior thorax first. The back is symmetrical, there's no scar, there's no any lesion, the hair distribution is even, and the color of the back is same with the generic background of the patient. So I'm going to be palpating it now. Do you feel any pain? No pain. The temperature is equally warm, there's no tenderness, there are no masses, and there are no any physical deformities that I can see or feel right now. So now I'm going to be palpating, I'm going to be auscultating the thorax. So for the auscultating of the thorax, I'm going to be asking you to take deep breath. Please, you take deep breath on each spot. I put my stethoscope in and out, in and out, in and out, in and out, in, out, in, out, in, out, in, out, in, out, in, out. So when the patient was taking deep breaths in and out, I did not hear any cracking or whistling sounds, which indicates that the lungs are clear. And can you take a deep breath for me? Did you feel any pain? No? Okay, so please can you turn back? Thank you. So for the anterior, I'm going to be checking for the anterior is 2, and the posterior thorax is 1, making a ratio of 1 to 2. Then I'm going to be assessing for the anterior thorax. So for the anterior thorax, I'm assessing for a minute, and after a minute, the rate is 14 beats per minute. The rhythm is regular, and the respiration is smooth. So now we'll be moving down to the auscultation of the valves. And for the auscultation of the valves, there are 4 valves to be auscultated. One is on the second right intervascular valve, and the other one is on the second left intervascular valve. So I will start 1, 2. This is 1, 2. So this is the second right intercostal valve, and it's called the aortic valve. And then the other one is on the left second intercostal valve, which is called the pulmonary valve. Then the third one is the fourth one on the lower side of the left intercostal valve, which is called the transcuspid valve. And the fifth one is still on the left side beneath the breast of the intercostal valve, which is called the metric valve. And then on these valves, I'm going to be auscultating it. I'm going to be auscultating for the S1 and the S2 sound. So to get a clearer sound of the S1 sound, the S1 sound is always found under the apex of beneath the transcuspid and the mitral valve at the apex here. So the sound is very audible and loud. Then for the S2 sound, is found on the base of the second right, the second left aortic and promic valve, which is just here beneath. And if you listen to it, the sound is equally very audible. Then we'll now be moving to the abdomen. So for the abdomen, please, I'm going to ask you to lie down again. We'll raise your shirt upwards a little bit, and I'm going to be covering you down. Then I'm going to inspect your abdomen. So for the inspection of the abdomen is in the midline position, and there's no any scar, there's no lesion around. The hair is evenly distributed. Then I'm going to be palpating the 4 quadrants. So for the 4 quadrants, I'm going to start from the left lower quadrant and I'll palpate it. Then I'll move to the upper left quadrant, then upper right quadrant, and then a lower right quadrant. So I did it anti-clockwise position. Then I'm going to be palpating the 4 quadrants. So in the palpation, please, I'll do a live palpation. Let me know if you feel any pain on all the 4 quadrants. Did you feel any pain? You're okay? Okay, then I'm going to be palpating the bladder, and the bladder is not full. That ends my assessment.